The Industrial Revolution was one of the largest changes in life since the end of the Ice Age and the Renaissance. It affected almost everyone in England, including the medical sector. As a surgeon, we have seen many more instances of surgical problems than ever before. A new age of surgery named scientific surgery arose, which is primarily credited to a man named John Hunter. He was known for his quality of work in the medical field. He studied the internal systems of many different animals, including humans, and with his knowledge, he was able to find many ways to cure surgical mysteries at the time. He also implied that surgery was to be used only as a last resort, as it is hard on the body. Whereas before, doctors would do unnecessary surgeries and treatments that made patients weak. He discovered many new surgical methods, including a better way to reattach an Achilles tendon. He also researched into the causes of tuberculosis and air pollution, realizing that the chimney sweeps were inhaling the soot and contracting cancerous diseases. Another discovery was anesthesia. Nearing the end of the Industrial Revolution, surgeries were done as quickly and as swiftly as possible, as everything was done with the patient awake. This limited surgeries to amputations. To cut and to go inside of someone's body was extremely painful and ever hardly used. But after the discovery of many pain-killing drugs and anesthesia, physicians were able to treat patients much easier.
The common compact living conditions of the day were almost never seen before the Industrial Revolution. It should be noted that during the wars of this time, most deaths were caused by disease, not combat. Disease is a biological abnormality or infection which affects the functions of your body. The revolution in England brought about a new age of medicine as doctors needed to find new cures for the medical mysteries which were around at the time. Not much was known about the causes of most sicknesses, so a majority of work went into trying to terminate these symptoms. One of the largest problems was smallpox. Smallpox is a contagious viral infection which can lead to death under uncontrolled circumstances. Between the mid-1600s and 1800s, the number of smallpox cases increased by 2%. Smallpox causes many painful, awful things, like nausea and vomiting, but most visibly are the large bumps that cover your body. It was only known at the time that if you were cured of it, you were immune from then on. This is what made it different from typhoid and cholera. Even though viruses were not defined until after the revolution, experiments and research allowed for simple methods of prevention of the diseases. Infections like cholera and typhoid were thought to be caused by smells, but by moving all the waste into the drinking water to terminate the scent of the feces, most people got infected when they drank it. Common treatments at the time included bloodletting to rid of the disease and the use of opium to ease the pain of the symptoms. Obviously, the Industrial Revolution drove much change in medicine and opened up a new era to the sciences of the time.
My part in the Industrial Revolution is to investigate the causes of common problems and find a way to cure them. By having more people concentrated into a city, it allows for larger research and medical operations to undergo. Many researchers were also physicians who applied their work to patients in search of results. Researchers such as William Budd, who discovered an indirect way of preventing the spread of infections, and in doing so saved thousands of lives throughout England. Most research was done into hygiene and living conditions. As times change, so do practices, and this is why we see unusual methods of treatments coming from the past. One new discovery of the time were x-rays. This is an example of technology that we still see today, except then it had commercial uses as well. X-rays were used in shoe stores to determine a perfect fit, and also in hospitals to see broken bones.